Hi, I'm Carol Greco, founder, owner, and CEO of WeCare4, which is a global, diverse community platform and portfolio of resources for all caregivers and other stakeholders interested in helping those who care for others. Our focus is on caregivers of the aging, and we also serve caregivers of adults and children with special needs. The catalyst for WeCare4 was my and my husband's parents. John and I were responsible for the care of both sets of our parents for over 25 years, including two with Alzheimer's, one with cancer, and another with heart disease, among all their other health conditions and financial situations. It was quite a journey and learning experience, ranging from care in their homes, then in our home, and eventually care facilities. It was extremely challenging in spite of my prior experience as the founder and CEO of a very successful childcare and elder care consultancy and placement agency called Family Care Necessities. I founded WeCare4 to make sure that others did not need to go through what we went through in our caregiver journey, trying to find the right help, information, products, services, and resources that we needed amidst the many silos and disparate sources. As one of my business associates, who is also a prior family caregiver, recently said, when you realize that you don't know what you don't know, you go to WeCare4. It is the one-stop shop for everything you'll need. Today, I'm speaking with Phillip Siculietano, who is on the WeCare4 advisory board. Phillip cared for his mother for many years until her recent death this summer, as well as his mother's three sisters who are not married, for whom he continues to provide care. Phillip has recently retired after 30 years as an award-winning special ed teacher and an adjunct professor at Kean College. I know Phillip quite well for many years, not only as my husband's cousin, but also as a great friend. In fact, we spent many hours over the phone, text, and dinner, when we could, keeping each other afloat as we each dealt with our respective family caregiver challenges. Phillip, I want to make this like conversations that we've always had over the years, where we talked about caring for all the people for whom we were responsible. Tell me what it was like to care for four people at once. What was it like? What has it been like? It's not was, you're still doing it. What problems did you experience, and what tough decisions did you have to make?
Well, hi, Carol. Thank you for having me today. You and I have talked about this, it seems like forever, as we began this journey. And it is a very interesting journey, right? It's something that you don't look for. It's not part of your career. It's not something that, no one really in the family raises their hand and says, oh, I'll do the caregiving, right? It kind of just falls to the people who seem to be the ones that internally are caregivers. It's something I found with so many people I've met along this journey that say, I have 6 brothers and sisters, but why am I the caregiver? And I only have one sister who, has been out of the state for the past 20 plus years. So, it was just me, but I think it would be me even if, we live next door to one another, right? So,
that feeling.
Right. I used to say some days, oh, I wish I had more brothers and sisters because there'd be help. And, I knew that from you that no, there wasn't, so it's an interesting journey, right? It's something that you haven't asked for, and yet it's a responsibility that I have taken and caregivers I've met take very seriously, right? It's not like you're, helping someone pick out furniture or plan on where to live. You're in charge of their health and their well-being and maybe their financial situation. We don't really talk that much about aging in this country, about death or, things that are going to happen to all of us, right? We may not be caregivers, but somewhere down the road, I think we really all will be. I've recently been looking at new nursing home facilities. My mother was on one end of the spectrum being cared for under Medicaid, right? So there's not a lot of choices. And I don't know, some people don't even realize that, right? So, when you have an elderly person who's leaving a hospital and they say, well, where are they going? Can they go home to live by themselves? Or, what are their financial situation? So much comes out of that can when they open it up, right? So you really need to know what's out there. And I really don't think it's a bad idea for people to be aware of it, to start early, to, peruse your website, right? To look at like, well, what is out there? Because when you come to it blindly, I found that was the most difficult thing, and the most difficult thing for people I was trying to help then, once they thought I was an expert, which I'm far from, right? But my mother went on Medicaid on one end. One of the better things I ever did was getting her eligible for Medicaid, because we knew her financial situation. She wasn't coming from a big home. She had no pension. She had minimal Social Security as a disabled woman. She was a widow 35 years ago. So you have to know your family history, right? You have to know not only their health that you're going to be guiding, but their financial piece. My mother's sister was on the very different end of the spectrum. She had a very good pension. She had a good Social Security. She had finances. She was not going to be eligible for Medicaid. She went to a facility 5 years ago, to give you a little back history, because 3 doctors told me she had 3 to 6 months to live. I thought I was going to be late for this call today because I was at that nursing home, because 5 years later, she is still alive. 2 of the 3 doctors have died, which,
Oh, God.
the irony of it, right?
Right.
Who said this is what was going to happen. And so what I thought was going to be a short run has turned into really a long time to be in a facility. She's going to be starting the 6th year there. And there were some minor issues today, but it takes a lot of time. It takes a lot of energy. I don't know how, for the majority of the time, I worked, as you said, as a special education teacher, which, is a very draining career, very rewarding, the same way I find caregiving is. It's almost that same calling, if you will. But I don't know how I managed to work a full-time job and manage 2 women in 2 different facilities, because it couldn't be easy that they could both be in the same place, right? Again, for those financial reasons, they were in 2 different places. And then there are 2 other sisters that I care for who live in a 2-family home with me. One is more seriously ill than the other. So, it's a lot of that juggling. And I always say, whether you're an organized person or not, you need to become an organized person, right? You and I both have that background, I think, of being organized. And I think you'd agree, like without it, we'd really be lost. Because on some days I was so organized and I was still lost, right?
I understand completely. One of the things that you mentioned was how your aunt was alive almost 5 years longer than you had anticipated. And I remember saying to my husband, John, I'll say that for the audience. Of course, you know John.
Yes.
But what's interesting is my father didn't plan financially for the fact that my mother lived for 16 plus years with Alzheimer's, outlived him, and all of her siblings passed them in age when she finally passed. And you just don't know. And like you said, both of us are generally organized people. I've been told that I suffer from OCD. Everything in its place, everything has its place, so get it in it. And I think caring for as many people as we have, if you're not organized, it's just going to make it more difficult, and you find that you will become organized. And I also agree with you on the fact that I have 3 siblings. 2 are out of state and one's here not far from me, and he was only an hour away from my mom or less. And we just it was me. I was the it person. So you are correct in realizing that even if you did have siblings, you're the it person. And I think I've talked with other people who have multiple siblings, and there's always the one who takes on the joy and the bad parts of caregiving.
Exactly.
And there is a lot of joy involved. What the memories, we could talk about that, the memories that you have with your family members, knowing that you've helped them and helped them go to their rest, to die peacefully. Those are the kinds of things that you feel good about, that you help them have the best possible end that you possibly could.
Yeah, definitely. I mean, with my mother passing, as you said, in July, you start to think back to what felt like being in the trenches, right? Battling, through the nursing home. My mother had gone in straight into long-term care, skilled nursing, where my aunt was much more mobile than my mother and was in more of an assisted living with a care level, right? But you look back now and you realize, as bad as the times were, there were wonderful times, there were funny times. You have to laugh. You're at the mercy of a lot of people at a lot of agencies, whether they're state agencies, federal agencies. I always say to people, no one should ever have complained or moaned about the pandemic unless you lived in a nursing home facility. Because it was just such a difficult thing to live through. And yet, you had to make the best of it, right? And you look back, I remember my days of, being on a ladder. I used to carry the ladder in the car to put to the nursing home window.
I remember you telling me, with the gopher hole right next to you.
When you couldn't get in, and it was like, well, I need to see her, right? We still need
to knock it on the window.
So, you'd be with this ladder against a window trying to look in. You have to look back and think of those times, because it is difficult work. I would kid no one when I say, there's a lot to do when you're caring, and especially, unfortunately for us, it was multiple people. And you're right. I think it's a conversation that, I consider myself a young adult, but I think young adults. Yeah, I think young adults should be having with their parents. What are your thoughts? Where do you think, but no one likes to talk about, the end of life in this world. I don't know. But I think it is a conversation. Would you want to be? And sometimes even what they want may not come to fruition, right? Because, from my mother's situation, she always kind of poo-pooed the nursing home idea. But she became so disabled, it was just impossible to find the resources and to bring people in. And you mentioned the finances. I would say to people, I was not a financial person, right? I was a special education teacher. And you have to, and I love to control situations, but I learned very quickly on this journey, you have to reach out to other people. You have to find where is someone else's expertise in this group of people who will come forward and say, what can I do to help? What can I do to help? But if you are not of that mindset to say, well, maybe you could do this and maybe you can do that, right? To let go of our wanting to control it all. Just today, I have to say, I left my aunt's nursing home and she needs a new television. And one of the aunts who's home, who has all day and, can get on a telephone, they use a very local appliance guy that they love. And it was like, oh, Philip, just call him and, get a TV. And I was ready to start, dialing. And I said, well, I'll give that job to Aunt Jerry because, I'm sure, she could do something. And, she loves talking on the phone. And, you have to figure out where to delegate even what seems like simple things, or it will overwhelm you. And I learned that the hard way. And I learned it a little longer into the journey. So I definitely say, reach out to wherever you can find some help.
Philip, remember when we talked last, you talked to me about the your books, how you manage the process with your aunts.
Yeah.
And one of the things that I didn't have the luxury of when mom went down the deep end with Alzheimer's, and I had no information about John's parents' health history. John had some, and was able to fill in some of the blanks. But having talked to you, you have a heck of a lot more history than I did. It was really, if there's anything that as caregivers that you want to be prepared for and tell as many people as you can, that have your stuff ready to hand off to somebody, because if you're not, if they don't know who your doctors are, they don't know how to get into your accounts, your healthcare accounts, you better start documenting that so they have that information. So talk to me about and talk to the audience about one of how you managed with all your books and how that worked for you.
Well, here's one of the books. I'm very old school. It's a very old school journal, right? But I cannot tell you how many times this book came into hospitals with me and emergency rooms with me. I'll never forget. I also will do like surgeries, right? Like I didn't know my aunt in 1947, right? That she had her appendix out. I arrived at the ER one night, late at night, and the doctors, some 30 somethings said to me, "Oh, we think it's her appendix. She was in terrible pain." And my aunt had a very long health history from what I remembered going back 30 years when I was in my 20s, and she had breast cancer. So, that to me was like where her health history started, but it really wasn't. And as she and I began that journey together 30 years ago, and then she had, mastectomy and chemo and radiation, and then the radiation did some damage to the heart, and we had a hip replacement in between, and then we had open heart surgery. And, I knew that, but I kept asking her questions. And so when I got to the ER that night, they said she was in terrible pain. I'd never seen her like that, I have to say. And they thought it was her appendix. And I said, well, wait a minute, let me get the book, and I would open the book and flip through the pages, right? And I said, oh no, she had her appendix out in 1947. It says so right here on this page. And I said, I remember the stories. It was after the war. And, the 30-year-olds were looking at me like, the war?
What war?
What war are you talking about, Star? And I'm like, listen, she has no appendix. I have it documented. It was 1947. So stop looking for an appendix because you're not going to find it. And it turned out to be her gallbladder, actually. So, those things so come in handy. I keep a tiny little like credit card size date of birth, right? Like how many people out there could tell me their aunt or uncle or people they're caring for, maybe even their parents, their actual date of birth, right? Needing a social security number, somewhat handy, a Medicare or Medicaid number handy. And then, it's the list of her meds. Because I can't remember them all. And now I have 4 women who are, who's taken that, who's taken this, are they all taking the same?
And the dosages and how many times a day.
Yes, yes. So I would, even laminate that and make it almost into a credit card and put it in my wallet. So then it was on me all the time. This book and many of these books, mostly 2 of them, have come with me everywhere. I have been called, in a restaurant. I've even been called at the nursing homes when, they have, which they should have, we would hope have really good records, and they've been there for years. But, you got it. One day I got a nurse that was coming from an agency, kind of a really bizarre, horrible story, but you'll hear them if you have anybody in nursing homes. And they didn't want to give the medication because they were looking for Elizabeth Toole, and her door said Betty. And I'm like, well, that's like a nickname for Elizabeth. They call her Betty. Everybody calls her Betty. Well, no, I can't. I'm looking for Elizabeth Toole. And I had this very bizarre conversation with a nurse that made me nervous that she was the one in charge of giving the medication to Elizabeth/Betty. So, I was able to say, well, I could tell you what she takes, so you could verify that it's the same chart, and trust me, it's the same woman. If I can give you the information, and I never would have had any of that at my fingertips in the middle of a restaurant, like on a Friday night when a nurse came on. So you have to have those types of records. I say it forcefully because you will find yourself, if you are a caregiver, in that situation, and you might become upset or emotional at the time, right? So you really have to pinpoint. I do a list of surgeries. I do this book that I journal in, when did they have a pneumonia shot last? When, I can't even remember when I had a flu shot last, let alone somebody else. So, my aunt had this very extensive open heart surgery that kind of went bad, and I had, I don't know if you can really see
I
it.
can see it. Yeah.
Right? But I had a very bulleted, detailed, how many catheterizations? Catheterization didn't work any longer. The artery collapsed. What did we do? What did we try? And I have to tell you, doctors are very grateful when I walk in there, I have to say.
Well, I've got to say, Philip, that I was not as comprehensive with regard to the information that I had of both my father, my mother, and then John's parents. However, a lot of what you're doing, you can now do through the portals, the health portals.
Right.
And a lot of that information should be on the portal. And what occasionally we need to do when we bring them to the doctors to make sure that information is updated. So many of us who are working with multiple people, what you need to keep in your wallet is that passcode, the username and passcode, and make sure you have that information on you so you can go to the portal.
Right.
There's also technology. We're looking, we have the WeCare4 has the Care Village Hub. And that is something where you can have all of that information, the medications, the prescriptions, the dosage, the doctors' names, the background history, and you can journal in it. That's things that are just coming into fruition in the last couple of years, which you've been doing this for 20 something years. And so have I, because you have your blue book. I had a little blue binder, and I also had a 3-ring binder that my mother was cared for in our home for quite some time, as well as John's parents. So I had notes that I would give the caregivers in these binders saying, this is when they eat, this is the food they like, this is when they go to bed, here's their medication. They couldn't give them the medication, but I had it. I had all that information in there. You were much better than I, knowing all the operations. John's mom had extensive heart surgery, and she also had Alzheimer's. John's dad had a multitude of heart operations. My father, not so much. He had bladder cancer and then went into the same cancer that causes bladder cancer causes lung cancer, and he eventually succumbed to lung cancer. And that's when Mom came to live with us, and she had Alzheimer's for so many years. One of the things that we talked about, remember, with doctor's appointments,
yes,
I know that you do this, and I know that I did this. I made sure that when Mom came to live with me and John's dad was already there for many years, I made sure they had the same doctors, except the primary care were different because one was male, one was female. But I had them in the same, the Summit Health group. And I would take them to the same podiatrist, the same, a couple of the same doctors, which, the same person who checked their ears. My mother had hearing aids. I know that John's father had wax in his ears. So you had all those things you had to deal with. And one of the funny stories that I tell is that one of those doctor visits, I was feeling kind of goofy and just tired. They had these long corridors, and I know that it was a pain for like 80 something, late 80 people to walk down these long corridors. They had the identical, of course, I bought 2 of everything, identical walkers. And so I lined them up in the hallway, and we had a race. And they really got into it. So it was hilarious. And then I was also accused of, because I was buying them clothes, they often had the same color clothing, the men's version and the female version. So a lot of times, unbeknownst to John's father would put the same color on that my mother. So I have pictures of them with the same brand clothing in, the female male version. So it was kind of like, I tried to wherever I could combine the effort. And that's also many of us who have multiple kids, and I had multiples, twins, you try to like group as much of the stuff as you can, otherwise you start to go bananas. And as we go forward, I mean, right now, 21st century, 2022, almost 2023, there is a technology. And come back to me at WeCare4 at WeCare4.com, and you'll see how we progress on the Care Village Hub. That's one of the things that we like to be able to offer people to help them manage this. So maybe the paperwork gets less and less, but I still keep hard copies. I still keep on the important stuff a hard copy, so that if you have to run and go and you forget your phone or something, which is highly likely when you're panicking, you have it at least in your pocketbook.
Right, but having that, the WeCare4, that hub that you talk about really is such a benefit today because, I mean, I started old school because there wasn't that technology,
That's
right?
right.
And I just stayed that way. But it would be so good even for people, to go on and look at it even for themselves to say, oh, I can like access information, or I could even, older people maybe could put their information in or give
Absolutely.
their information now that you might not even use for 2, 10, 15 years or whatever it might be, but you would have some access to knowing even their history just by having the conversation of going to the WeCare4, website, because you
Even,
have to have that conversation, right?
and
In
you
order
can,
to know.
you could even access, you can give certain levels of access to the caregivers as
Right,
well, the professional caregivers. So if
right,
you have someone who's watching your mom in a nursing home, or even watching, I mean, even more importantly, at home, they can access the information. They know how to get a hold of, like if my sister who wanted to know something, she could go on it and she could
right,
look.
right.
If I was out of commission, or sick, or I needed to travel on business, then she could do it.
Right.
Um,
And everyone really has a cell phone today. I mean, even in all the nursing home facilities I've been through, and I've been through a lot of them, everybody's on a cell phone. I had a private aid that worked with my mother at the end, so she could have been on that cell phone and accessing something if she couldn't get a hold of me, if she needed something, if she
Yep.
needed information about my mother. It's really, it's a wonderful tool that I think, people need to use. And just to circle back to about the conversation, right? I think the whole WeCare4 platform would just give that conversation to people that I think we lack now, to say, well, do you want to do not resuscitate? Do you want to do not, intubate? You talked about having those the charts through the doctors now, right? Through like Summit and the different hospitals. I even set them up using my own username and passwords, right? Because my, 86-year-old mother really wasn't going to start, even when they first started coming out, she was like, oh, I don't need that. I don't have to sign up for that. And thank goodness I thought to myself, well, maybe I do want to see if she's in the hospital, like how a test came back, or what did the chest
Yep.
x-ray
The test
say?
results.
So,
Yep.
right? Because you can't get a hold of a doctor or a nurse in a hospital. And like I said, I did a lot of it through COVID, which was, it was almost impossible to talk to people live during that whole thing. But my phone would get a notification because it was set up, it was
You.
her
Yep.
information set up through me. So I really knew the username and password. And boy, could I at least almost feel like I was in touch with my mother's health condition, because you saw blood work, you saw x-rays, so that's something, that technology through those medical groups and hospitals is something I would say,
Yeah.
please
And
sign up for.
yep, absolutely. And whatever works, whatever password, if your loved one or friend or family member insists on having their own password and username, you need to get that from them. Otherwise you're going to be crazy. Tell me, I mean, Philip, we talked about a lot of things here, and I know, I mean, the suggestions that you have, we've talked previously on this topic. How do you guide people that are in the same situation? Because a lot of people think that you're only caring for one person. Say, oh, you're a caregiver of one person. No, it's not. A lot of times it's people have parents. They may have a child with special needs at home, and it becomes a whole scenario. And I know that this, being a special ed teacher, and I'm sure you came across where somebody's watching. You talk about the sandwich generation. It's more like the vice generation, as John would say. And it's only going to get worse for my kids, the millennial kids,
Right.
who have, I mean, we are geared to live longer. I mean, we've
Right.
taken better care of ourselves. There's more medicine, there's more medical treatments. And like you said, we need to be able to make sure they know how to take care of us. So tell me, what suggestions do you have for people in the way of, closing with our closing thoughts on this?
Well, we talked about caregiving, right? That actual, the whole piece of that physical caregiving, whether you're finding, care in the home, care in a facility. We talked a little bit about that financial piece. That third piece is the legal side of it, right? You really
Yeah.
do have to look into that legal aspect as well. Are you a power of attorney? 3 initials I'm tired of having really at the end of my name when I sign POA. And unless you do it, it was like, I thought I was God. It was like, oh, you're the POA. Oh, all right. Well, we need you. You could sign anything. You could do everything. We can, so there's that legal aspect. So, for me, I would say to people, you've got to start these conversations. I was just talking about this to my aunt. I said, I never really saw the aging process. By the time I was 8, all 4 of my grandparents had died. My father died when I was 22. He was 55. So I never really saw people get old and how does it happen and what does it look like until all of a sudden, these 4 women who really took care of me, right? All of a sudden became, 65, 75, 85, and things started happening. So, I think you should start those conversations early, especially if, you haven't had, that exposure to people who were ill and who eventually died, whether it was, in the home or in a facility, and get yourself prepared. You have to take care of yourself too. And I never learned that until very recently, that I'm a caretaker, right? But I'm a caretaker of me as well. Like, towards the end when my mother was ill, I felt like I was really, and maybe it was more during the pandemic, almost getting sick, right? I wound up with COVID. I had lost some weight, and I just knew like, oh, I'm not really taking care of me. And I can't take care of anyone else if I don't take care of me. So, put that at the top of your list as a caregiver. If you're out there and you're listening to this, I think you have to almost, caregiving is such a selfless act. You're taking care of so many other people, but you have to be a little selfish in the sense, you said it before about the doctors. My mother and her 3 sisters, they thought I was a lunatic when I said, why do you women go to 4 different doctors? Why am I driving to 4 different locations and calling 4 different people? They had 4 different GPs, they had 4 different cardiologists, and I really had to like work it to say, listen, we're going to one doctor. We're done with this. Like, I can't, like I need to talk to one person, and I can't tell you how much easier that made my life. Yeah, in the beginning, I think they were a little annoyed with me, but you have to push through that. I would say you've got to, again, worry about taking care of you. They were still getting excellent care, and, things like that are so important to have in place. And again, I guess I really would go back to having the conversation. And I think the WeCare4 platform really is a springboard for having that conversation. I learned all of this the hard way through a book and paper because it was, trial and error. And
You don't have to do that anymore.
You don't have to do that anymore. You don't have to do that because of your platform, because of technology, because of what the hospitals and medical groups are offering. And, we're a society of conversationalists now, right? I don't know if I would have gotten this same information out of my grandparents back in the day, right? But, hopefully we're becoming, more communicable in conversation and talk. And, there's news 24/7. I mean, it's kind of who we are. So why not have it and know information that you're going to need to know down the road, right? I say it to you who have, children in their 30s. If something happened to the 2 of you together, would the 3 of them be able to say, oh yeah, we know all of mom and dad's, right?
It's interesting. The boys go to John's doctor, but they don't have a clue who my doctor is. So that would be, as we were having this conversation, I'm saying it's like the cobbler with the kids with the holes in their shoes and the plumber with the leaky pipes. But I think, my key takeaways from today's conversation is, we talked about organization and I know that we've mentioned, and we may have not mentioned in this conversation, your priorities, to make sure you understand, your priorities, organization, however it works for you. Even you may not be the most organized person in the world, but you'll become more organized because out of necessity. And the other thing too is that we brought up WeCare4 as a resource, but I need to tell you that there are many, many resources out there.
Right.
What I wanted to do at WeCare4 is be the place where you can go to learn about those other resources and
Right.
go to those other resources and take advantage of them. Philip, you brought up about taking care of yourself. I think that is key. I think you remember when I wound up, I was up 2 nights in a row with my mom when she was hallucinating in the middle of the night. And the first night I was up trying to get her with a professional caregiver, trying to get her into bed. And then the second night, worried about what am I going to do now? Woke up and wound up as I'm putting the leash on my puppy, my dog. I got up and smacked my head and wound up with a severe concussion, and wound up in the a trauma center with my head. So that was the straw that broke my camel's back. I was, like you said, it takes a toll. And I want to talk a little bit about, is there anything else that, any other takeaways that you've had from our conversation?
Well, I mean, I think we put out there a lot of information, right? I mean, I could, talk about even more specific things in the future, if there's a need for it, because I think we gave out a lot of information, but you really
general stuff,
right? You so could break down the caregiving role, like I said, as caregiver, facilities, medical, financial, legal, right? I mean, we probably could talk for days and days and days.
Yeah, for 4 hours, right? And you as a teacher, would want to do that. And me just being the kind of person I am, I want to tell that. But one of the things, and this is a great segue into some of the things that I've done on WeCare4. I put together a job board and a career center where both caregivers can go to post positions, find help, and they can also, professional caregivers can also find in-home and care facility positions. One of the things that I wanted to do was have a directory, and I call it a marketplace directory. And this is and in that marketplace on the WeCare4 site, it's not there, it's not 100% there yet, but it's coming. In fact, we won an award from the Association of Directory Publishers, ADP. We won the 2022 Directory of the Year Award, and we were certified as a trusted local publisher. And what we were trying to do was to put together a directory of all of those aspects of, we have telehealth on that, which is a special program from MD Live. I have Silver's Adaptive Clothing, which I wish I knew about when my mom was alive,
Right.
and footwear. And we have a special 25% discount using the promo code for WeCare4. But it also has all the products and services that are needed. You'll find lawyers, you'll find financial planners, you'll find hospice facilities, you'll find care advisors. We'll have a listing of all of those. And then as a trusted local publisher, as we begin to vet those people, they'll rise higher up in the list. I also wanted to have a place where there's news and articles. So anything that comes out that's new, a new drug, a new Alzheimer's drug that just come out. So if you not happen to be on the Alzheimer's Association site, you'll see something like that on our site. And in the expert forum, and you wrote, both of us have written and put information in there, but we have other experts who talk about all aspects, the legal aspects, all of the different products, services, resources. So all of that's all taken care of. And we talked about the WeCare4 Village Hub, where we talk about, that particular portal, the social channels. WeCare4 has Facebook, Twitter, LinkedIn, where people can talk and share information, just like you said, where we talk, we chit chat. We will have, right now, all of our meetings and events are virtual, but we are working with other people that have meetings and conferences so that people can attend locally. And we're also working with several universities on putting together training programs for family caregivers and for nurses and professional nurses that want to take additional CE continuing education class. So I ask you in this audience to register with us, join us, register. It's free right now. Part of we're a community. We're focusing on those who help. We're helping those who care for others, and definitely follow us on our social channels. Philip, do you have any closing thoughts?
Well, I want to say, where were you 5 years ago? When it was so hard, because I listened to you and I know the site, and it's an incredible resource that people who are in the trench now need to go immediately. But I can't say it enough that people who just have elderly parents or have people who are ill in their family, right? There's even people who have, coming from the special ed background, chronically ill children and, children with severe disabilities. And, instead of, really having to find out through a million different channels, there's just so much information there that you've just put out there, which is basically everything we, kind of talked about today. But yet I had to find out about it from this social worker or that social worker, or meeting somebody in a coffee shop in a nursing home, or, talking to a chaplain, or through hospice, or and it was hard. It was for somebody who likes to be organized. The WeCare4 site, is perfect.
You said, where was I 5 years ago? I was still, mom was melting
Right.
away.
Right.
I had the thought to put this together, and I've been working on it for a very long time and still working on it. We announced this past December. So we are a year into it. The directory is in process.
Right.
The expert forum, we have people who've submitted articles. I have one from AgeWave that's on its way. So there's lots of things that we want to do. And go onto the social channels and let me know what you need to know, and talk amongst yourselves, as the comedian would say.
Yes.
Philip, thanks for your time. We
Thank
can do
you.
this again and maybe delve into a couple of topics in a little bit more detail, and we'll take it from there.
Anytime. Thank you so much. I appreciate it.
Have a good one.
Bye.
Bye.